everybody. Good evening. This is Dr. Sullivan again with you for another I Care for Your Brain Facebook lecture. We have been meeting here every Wednesday night at 6 since October. Can you believe it? It's been really satisfying on my end to do this, and I love when you guys give me feedback that it's helped you and that it feels like you are more educated and more empowered about brain health, which is so important. One of the things that's very special to me about what we do is that we're not just coming at brain health from a very narrow medical model. We're really trying to incorporate all aspects of brain health, which has to include our mental health, our social health, and our spiritual health. If we just look at things through a biological lens, what I'm afraid of is that we're really missing an opportunity to help people, and that we are really not connecting with people and validating their very human experiences. So this is why I chose to be a neuropsychologist, why I am absolutely in love with neuropsychology, and I think that over time a lot of you have caught the fire. So what we're going to do tonight is talk about a very important topic, which is chronic pain. And this is very important because many of you out there will have chronic pain in addition to something else going on with your brain. So what it's doing is it's adding on, piling on yet another layer of distress, maybe disability, discomfort, social isolation, trouble with your cognition. When you are in pain, it is taking up one of those precious 7 slots that we talked about last time. And most importantly, it is reducing your quality of life, your ability to be the very best you that you can be with this precious life that you've been given. So what are we going to talk about tonight? We are going to define chronic pain and talk about the specific subtypes that come along with it. We're going to really try to understand how exactly pain hurts us, because of course it's so much more than a physical sensation. It absolutely has social implications, there are psychological implications, and we have to bring this to the table, to the discussion. We're going to talk about what are the typical pain-reducing techniques that people are using nowadays, but I want to introduce you to some mental strategies. That's really why we're together tonight. What are some things that you can walk away from this lecture with tonight, knowing how to do differently that will reduce some of your pain? Now, I am not a physical medicine and rehab doctor. I am not a chronic pain specialist. There is a layer of your pain that I can absolutely do nothing about, the physical sensation as you experience it in your body. But I'm telling you, as a psychologist, there are 2 more layers that I can really help you with. So if you stay with us tonight for this lecture, when we get to the recommendations, I promise you, you will have some new tools, some new way to think about chronic pain. So when we think about pain, the first thing that we think is, of course, it's unpleasant. It is something that causes us a lot of distress. And what we know is that pain is very subjective, which is part of the problem with pain care, is even if we give people these, faces and ask people to rate their pain from 0 to 10, the faces are, happy, a little grumpy, very mad. The truth of the matter is that's just an approximation. That is just help us get inside your head, help us get inside your body as your doctor, and help us understand what it is like to live with this. But the truth is, words are going to fail. We can never adequately describe the experience of pain because it's very sensory and it's very psychological. So one very important thing that we have to know with chronic pain is that chronic pain is what the person experiencing it says it is, okay? There is no way a doctor can know your pain. And there's really no way that someone else can judge your pain. It's really that classic, you don't know someone's life until you have lived it. You don't know what they're living with until you've walked a mile in their moccasins, right? Pain hits on that really strongly. The best treatment for pain, in my opinion, is going to be a combination of working with sympathetic, talented physicians, psychologists, professionals, but also things that you are going to do to take responsibility for your own physical happiness. Okay, So let's just talk briefly about the descriptions that we have for pain. So we have acute pain and we have chronic pain. And the difference really has to do with time. So once we get over about 3 months of feeling pain in our body, it's considered chronic. And what we think is that chronic pain is much more pervasive. It affects people's lives in a much more deep way. It has kind of roots that take hold and really separate people from other important people in their life, separate people from their ability to engage in their leisure activities, their ability to work sometimes. And part of that is a process of adaptation to the pain. We're going to get into that in a little bit. Within the realm of chronic pain, we have pain that comes from 3 different sources. We have tissue damage pain, we have nerve pain, and we have what we call central pain. If any of you out there have a new onset pain syndrome that is happening post-stroke, very likely you have a central pain problem. And central simply means central nervous system. It's coming from the top down, from the brain down. Sometimes it may not even be something that is physically going on, say in your hand or your arm, but something is misfiring in the brain and it's saying to yourself, hey, this is an alarm bell, there's something going on here, you need to pay attention. If you think of something like phantom limb pain, this is the perfect example. So let's just say someone has to have an amputation of their lower leg. A lot of people for a long period of time can have phantom limb pain, and a lot of people describe it like it feels like I still have my foot, but it's on fire. It feels like it's slowly being burned over and over and over again. And really what this is it's a signal in the brain that's saying, hey, there's something wrong here, pay attention, because we have a internalized image of our body that lives in our brain called the homunculus. Some people call it the little man. And it's a schema in our brain that tells us this is what our body basically looks like. And it's hardwired from the time you were born, according to your body. So if you've been born with 2 arms and 2 legs, that's the map you have in your mind. If all of a sudden you don't have one of your limbs, your brain is going to be very distressed because something is not right. And really the brain is built around alarm systems, getting our attention when something is not going correct. So pain can either come from damage at the level of the tissue, the muscle, the nerve, like I said, or top down from the brain. So when we think about pain, I often think about the pain cycle. And again, this is where the other factors like our psychology come in. So of course, for many people, there is the actual physical distress, the pain, the physical discomfort. But we have a cycle that we get into, which is we try to do things to limit our pain. So maybe we're not as active as we once were, because when we're active, it hurts. So we do things like we become a little bit less active, we're more passive, we kind of guard ourselves physically a little bit. But what can happen is then you have less conditioning of your muscles, of your body, so you tend to be more stiff, you have more inflammation, which of course restricts your mobility, your ability to move around. Your muscles then become weak because they're not being used as much, and you are losing function. So in a sense, the very thing that we're trying to do sometimes, which is protect ourselves from pain, actually winds up making the pain worse. Now, isn't this interesting how this is a very close parallel to what we talked about last time, which is emotional avoidance. What I'm basically talking about here is physical avoidance. So not doing things because we think it's going to help us, but in the end, it actually winds up hurting us more. So breaking the pain cycle is something that we have to address. Sometimes the thing that you think is gonna help, it kind of comes back to bite us. So when we withdraw a little bit from life, even though we have good intentions, and again, we think it's helping us, this of course isolates us, and we not only lose abilities in terms of being social and knowing how to interact with people, we can become very comfortable with a low level of stimulation, so quiet environments. And like I told you last time, what can happen is then when you try to re-enter life, you are simply out of practice and you're very overwhelmed. Your nervous system is pinging and giving you all sorts of, no, stop this, this is too much for me, I need to shut down messages simply because you're out of practice. One thing that we worry a lot about in folks who have chronic pain is developing depression. But I want to bring this up because I think it's not very well understood. So what we think is that about 54% of people who meet criteria for chronic pain also meet criteria for depression. But the problem is only a third of those people are actually treated. And again, this is part of why I love being a neuropsychologist, because if we just come at pain from a physical perspective, hey, let's give you pills to get you out of pain, we're potentially missing a whole other aspect that is part of it. It's a pair. They travel together in so many people. So we have to be aware of the psychology behind all of these brain-based things, right? So the stereotype is that pain and depression are interrelated because, of course, it stinks to have pain, right? And that it makes you grumpy and it makes you sad. But what psychologists who study pain tell us is that there's actually an intermediary between pain and depression, and that is that decrease in activity. So when we do less, the main bridge that seems to take people into depression is feeling a loss of control of your life, feeling like your true self, what you would like to be doing, the roles and responsibilities that you have grown accustomed to, being a parent, being a worker, being an artist, that you are not able to fulfill these roles anymore, and that is the psychological distress that comes along with pain. So in the last 100 years, we actually haven't seen that many advances in terms of medical interventions for pain. So, we're still pretty reliant on anti-inflammatories, opiate medications, sedatives, muscle relaxants, these kind of things. But what has really changed are some more interventions that are a little bit outside that box. And the things I want to talk to you about tonight are actually the next thing outside that little box. So in that middle part there, we have things like rubs that people put on, epidural injections, TENS units, physical therapy, hot and cold therapy, things like exercise as medicine. All that stuff is great, and very few of those things have risk profiles that concern me. You're not going to get into trouble because you have done physical therapy too many times, right? It's not something you're going to become dependent on. But many people started to question, is there something else that I can do that's more within my control, that I can do on an everyday basis, that is free and that I have in an accessible part of my life? I don't need to get a referral. I don't need reimbursement from my insurance agency. What are some things that we can do? And that's exactly what we're going to talk about tonight: mental strategies for chronic pain. So we have to start this conversation, though, by having an agreement. And I've asked you to do this with me before. This is the first things first agreement. This is the, I realize I'm listening to you on Facebook. I realize you are not my doctor. I realize that you cannot diagnose and treat me over the internet agreement, right? Okay, we're going to shake on it. So first things first is you have to have a thorough medical evaluation in order to determine the cause of your pain. This is the exact same philosophy that I use when I do cognitive and mood evaluations. If I don't know where someone is, how can I really personalize their care and know how to help them move forward? So until you know the cause of your pain, until you know what a medical professional feels like you can do, I really don't want you to start to do these mental strategies, because the truth is, pain is a warning signal of impending damage, and we want to respect the body and listen to what it is telling us. Now, however, once it's diagnosed and once the doctor says this is chronic and we have done a lot of things, and the truth is you're probably going to have to learn to live with it, then we're going to start to bring in these mental strategies, okay? So what is so awesome about these is they can help you feel less dependent on pain medication. And really what I care about is helping you feel more empowered to manage your pain on your own. One of the things we know, what did we just say a few minutes ago, is that that loss of control is the bridge that takes us over to depression, right? To emotional pain. And what all these strategies are going to do is make you feel like you have some tools in your toolkit that you can pull out to do so you are not totally at the mercy of pain. So let me go through a list, and then what we're going to do is focus on 3 of them tonight. So these are things like hypnosis, guided imagery, biofeedback, relaxation. Okay, so you've all heard of these. Sometimes they fall under the heading of alternative medicine. And the 3 that we're going to focus on tonight are proper deep breathing. Breath has so much to do with our well-being. Something called cognitive reframing. And the last one I'm going to teach you is distraction. And they're actually very, very powerful, each one in and of themselves. But if you can bring them together and do them, you are going to definitely feel better, I promise you. So the first one is, despite the fact that we breathe constantly, right? Very unconscious, but can also be very conscious. We can control our breathing, right? Many of us actually have no idea how to breathe correctly. And when we are stressed or when we are in pain, we become shallow breathers. This is a huge part of why people have panic attacks, because they're simply not getting enough oxygen. Their breath stops about here. Right? Just think of yourself as anxious. You're not exactly taking long, deep, relaxing breaths. So the breath and mood have a very strong relationship. Again, when you're in pain, you are going to start to panic a little bit, because remember, the alarm signals are going off in your brain. But what we have to try to do is override those signals by calming the nervous system through breath. So what we know is that not only does the shallow breathing get us into trouble with not enough oxygen pumping through our body, that our heart starts to beat faster to compensate, but also our muscles get tense because they're not getting enough oxygen. Tense muscles are going to result in more pain. That is a fact. So the first thing we have to think about is just simply being deliberate with our breath, slowing down enough to be conscious of what is happening in our body. So many times if I get anxious about something, it's not until I'm kind of down the road of anxiety that I realize that I'm totally shallow breathing. And you have to stop. Some people will say, I imagine a big stop sign in my mind's eye, or 2 big fists, something that just says stop. You have to take this serious, and you have to get deliberate about your breath. So the idea is that 5 to 6 big, deep belly breaths, and we'll go into some details in a minute, seems to be what stimulates what we call the rest and restore response in the nervous system. So we've talked about things like the fight or flight response. This is what is related to a lot of anxiety, a lot of panic, things like post-traumatic stress disorder. And what we want to do is get the nervous system out of that state of panic, and we want to get the parasympathetic nervous system involved. So 5 to 6 big belly breaths within a minute seems to be the amount that kind of restores this ability. And you want to try to do it for about 5 minutes at a time. Now, the key to good breathing is actually very, very simple, and it comes down to 2 simple strategies. The first one is pulling in your breath so far down that it's in the very, very bottom of your lungs, almost where it feels like it's in the bottom of your stomach. Number 2 is you actually want to have more out breath than you have in breath. You can actually cause yourself to hyperventilate if you try to do this and don't bring the breath down further enough, and maybe take in more air than you're actually letting out. So you can count in until about the count of 4, but you then want to exhale about 20 more %. So exhale to the count of 6. I think that's very, very interesting. I didn't know that until a couple of years ago. And again, it's one of those things, if you have kids or grandkids, what a wonderful tool to be able to teach them how to calm themselves with the breath. The next one we're going to talk about is cognitive reframing. And this gets back to one of our psychology principles, which is feelings don't just happen to us, right? Feelings and thoughts are very related. And typically, almost always, the very first thing that actually happens in the brain is an event, right? Then we have an interpretation. How is it that we make sense of that event? And then we have our feelings. So very, very interesting stuff. And I've talked to you about this before. You can actually slow down your thoughts and your feelings and realize when that little pause is happening, or how is it that I'm bringing thoughts into this feeling and setting myself up for a negative outcome or feelings of anxiety or depression. So let me just give you a couple examples. So this is all based on the premise that our thoughts become our behaviors, which become our truth. Pretty profound stuff, huh? So if your thoughts are things like, my body is failing me, I'm disabled by this pain, I can't do anything, this is going to end, this pain is going to kill me. What are some common behaviors that would go along with those kind of thoughts? Well, not getting out of bed, sleeping too much, staying away from people, stopping activities that have the potential, you might think, to increase pain. Maybe taking a little bit more pain medication than was actually prescribed. Now that one's interesting because I actually find the opposite to be true, pardon me, in my practice, which is more people don't take their pain medication as prescribed than overtake it. Now it might just be the population of people that I see, but we have a lot of concern, rightfully so, about opioid overprescription. But there is also another side to that story, which is that plenty of people have prescriptions and they actually don't take them like they're supposed to. And we're going to get to that when we start talking about treatment. But the truth of the matter is that the way you think about pain really, really does make a difference to your experience. So let me just flesh this out with kind of an example. So let's just think about our friend Sandy, okay? And Sandy has rheumatoid arthritis. Now this, of course, is a very painful, inflammatory version of arthritis and can really cause people a lot of pain. So let's just say she wakes up again on a Tuesday morning and the thoughts that start running through her brain are, oh my gosh, here I am again. This is so awful. I cannot possibly get up and go to my exercise class. I have so much to do. That instructor's going to be mad at me if I don't go. I really can't deal with this anymore. I don't know what I'm going to do. So as a result of this, Sandy winds up staying in bed, misses her class, doesn't see any friends, and sleeps the day away, and then is up at night and has insomnia. Now let's just say Sandy is able to replace these thoughts with some more balance, or what we might call adaptive thoughts. And now let's say she wakes up and says something like, you know, the pain is really bad this morning, but I know from past experience, if I can just get out of bed, if I can get myself in a hot shower, if I can do a little bit of stretching, I really think that I can make it to the class. Maybe not the morning one, but I know they do one in the afternoon. I think I can do that. That instructor has actually been very understanding to me in the past. I'm sure he deals with people who have chronic pain a lot. He knows I work really hard and I get there when I can. I think it's going to be hard to get there, but I think I'm going to really do this. How different are those thoughts? How different are those outcomes? So monitoring our thoughts and disputing the negative global beliefs with ones that are more rational and balanced is unbelievably helpful. Really not just in chronic pain, but in all sorts. I mean, that's the essence of the beauty of studying psychology, is you get to learn these kind of golden rules that really apply to so many things that bother us as human beings. So I think that one is quite powerful. So the next two have to relate to a really interesting diagram that I want to share with you. So the idea is that it's not just the physical experience of pain that hurts us, right? That there are actually two other layers to pain, and that is fear and attention. Okay, so I know you're not gonna, my words are gonna be backwards, but all I want you, pain, fear, distress, attention. What I want you to notice is that it's when the pain and the fear and the attention come together that we get distress. And really, that's what you can control, is your distress. I cannot get into your body and change the way your joints are degenerating, or get into your brain and change the overstimulated brain cells that are causing you to have central nerve pain. But I know as a psychologist that I can help reduce your fear related to the pain, and I also know that I can help you with distraction which is so, so, so important. So research tells us that there is a very strong relationship between focusing on the pain, focusing on how bad something hurts, and worse sleep, more anxiety, and guess what? More pain. So when we focus on pain, we all do catastrophizing, okay? Is my pain getting worse now? Okay, how is it now? I don't feel like this is ever going to go away. There's nothing that I can do. All these thoughts, all these things that we tell ourselves, what are we doing? We're honing in, we're focusing on the pain. And that's like a magnifying glass on the pain. So this would also include things like Googling your pain symptoms, random pain in the left ankle. Next thing you know, you've got ankle cancer. It's true. The more you focus on something, the more real it's going to seem, and the more space it's going to take up in your mind. Now, one other thing that can happen in chronic pain is we can focus on it by making it the focus of our conversations with family and friends. And I'm just going to tell you that will alienate you from other people, because the truth is that after a while, people don't feel like they can help you. And because pain is so subjective and people don't understand, I don't think that you're going to get the connection with important people in your life that you want. Now, that's not to say that I don't want you to talk about your pain, because if you know me by now, you know that empathy and connection is something that I really, really value. But the point is, we simply do not want your pain to be the only thing that you talk about with other people. So let me give you a research example of how distraction can help people, because that's what we're trying to do here, right? This is a science-based discussion. When people have severe burns and they have to go through treatment for burns in inpatient units, it's thought to actually be the most painful thing that someone can go through. So unfortunately, burns are very susceptible to infection, and what people have to do in burn units is get these very, very tender wounds. Really, there's certain debriding is one word for it, but basically they get scrubbed, and medicine, antibiotics gets put in there so there can't be an infection that develops. Well, guess what? This is excruciating. So there have been some virtual reality programs that have been developed, and what's really sweet is they do it a lot with kids, which is awesome. And what they do is they have kids set up on these, headsets where they can see a little scene. And there's one that has snowmen, and what you are able to do is shoot snowballs at the snowman. And so the more snowballs you hit, after time, the snowman is able to fall over, and then you get a point. So when they have kids do this, when they have kids distract, children in this study report 30 to 50% less intensity to their pain. So something as simple as not just sitting there and just having the only thing that you focus on, the pain, taking your mind and putting it elsewhere, can cut pain in half by half. Cut pain in half by half. That's unbelievable. And this is because we have a very limited attention span. It gets us back to that number 7 again. If you have other things going on in your mind, you literally can't process the pain. There's no slot for it in the same way that you would otherwise. So how can you bring this research finding into your own life? Well, the first thing is, typically people have pain that's focal, right? Even if it's your back and your neck, you still will have some part of your body that's not in pain. What you should try to do is focus on the non-pained parts of the body as well. So you can do a little body scan, do your deep breathing, and you can go around and say, you know what, my feet actually feel really good. I'm gonna move my feet around, I'm gonna get some oil out, I'm gonna massage my feet. I'm really gonna focus on this part of my body that feels really good. That is a great way to physically distract yourself. You can also focus on your other senses, because of course touch is one of our senses. So if you smell something that makes you feel happy, if you're able to look at something visual, if you can listen to music, anything that you can do that will take your focus away from the intensity of the pain will absolutely help you. So what are my take-home messages for today? The first one, of course, is you need to be knowledgeable about your own pain. Remember, it's very subjective. Nobody can tell you what it is that you are feeling. I want you to work with medical and psychological providers who understand pain, not just physically, but the psychology of pain. And I want you to try to walk this fine line between, you should take your pain serious. Remember, it is sending out alarm signals maybe for a reason, but I don't want you to take it so serious that it actually becomes the focus of your life. And I know that that's hard and it's much easier said than done. But the truth is that you need to have other things that get as much attention as your pain. I want you to also walk that fine line with your pain medications. You shouldn't overtake them, but I also don't want you undertaking them, okay? And what I mean by that is you really have to stay on top of pain. And we all know this just from having headaches, right? Everybody gets a headache from time to time. If you nip that headache in the bud with a little bit of medication, chances are it's not going to grow and blossom into a big old migraine. Same thing with pain. Sometimes a little pain medication on the front end can actually save you from having to take more. There's a lot of concern. People don't want to get hooked on these medications, and I understand, and I think it's wise to be cautious, but I also don't want people in unnecessary pain if they don't have to be. Staying active and really doing things to maintain a sense of control in your life is critical. That is what the research tells us will keep people from slipping into a depression. If you have stopped doing a lot of things in your life from pain, I want you to slowly try to crawl your way back in. Maybe not in the same way you did things before, but try to find some way to feel like you. Our identity and the things that we do, the roles that we accept in society are very, very, very important to our ego, to our sense of our identity and who we are. And if pain has taken you away from those things, you are going to feel lost. That's absolutely true. So you have the job ahead of you to try to feel like, how can I get some of myself back? And then the last thing is I want you to watch out for that negative thinking. You have to slow down and realize what you're doing now before you can make the change. So in the next few days, when you feel an ache or a pain, listen to yourself. What is it I'm telling myself? Am I catastrophizing? And believe me, even though I know these things, I do this stuff all the time. So it's not like once you know better, you're perfect, you're an angel. It's a discipline. It takes work to sometimes say, oh, right, okay. I'm not just going to be on automatic pilot here. I'm actually going to try to use those skills, use those strategies. Okay, I hope that this was helpful to you. If you feel like it was, please leave me a little message here. You can share it. So many people are out there suffering with chronic pain. I know if you share it on your wall, it's going to help someone out there. And that's really what this is all about. How can we educate and empower more of us about brain health? I will be back with you next Wednesday as always, and I'm actually going to switch topics a little bit, and we're going to circle back to dementia. That is probably, of all the things that I'm interested in and care about, dementia is probably the thing that's closest to my heart. And so I want to start off by telling you answers to the 4 most common questions that I get about dementia. It's kind of amazing when I go out and I do my talks and I meet with people, there's 4 questions that come up time and time again. So let's go over those. We're also going to, in the next couple weeks, get into dementia and driving. That is a very delicate conversation, and I think I have some really good, time-tested, clinically proven ways to start that conversation to toe that fine line between being respectful but also keeping the person safe. We're also going to talk about Lewy body dementia in a few weeks. That is the most common yet underdiagnosed subtype of dementia. It's very important that we talk about that. And I recently asked you guys to chime in and give me some ideas, and man, you gave me some really, really good ones. So I'm going to be going through that and doing my best to come up with more and more lectures. And I think that we're having a good time here. So leave me a message and let me know what you thought of this one in particular. I hope you guys have a great night. We are deep in pollen season here in North Carolina, and I think a lot of people out there are sneezing and sniffling. So I hope that that's not you, wherever you are in the world. I will see you guys next time. Take care. Bye-bye.